Good afternoon, everyone. Our topic for today is the continuation of our last lesson. It's the first aid. And today we will discuss about CPR. Is there anyone who knows about CPR stands for?
I know. Call police right away.
Not really good try. Is there anyone who knows what CPR is? Yes?
Cardiopulmonary resuscitation.
That's right. Yeah, CPR is a cardiopulmonary resuscitation. And CPR is the technique of rescue breathing combined with chest compression. And the purpose of the CPR is to maintain a circulation sufficient to preserve the brain function until specialized treatment is available. And there are some steps for resuscitations. Is there anyone? What are the steps for the resuscitation? Yes, Joyce?
Is it Dr. ABC?
Not really. It's a good try.
I think it's doctors ABCD.
That's right. Doctors ABCD. Yeah, additional of S and D for defibrillator. There are some steps for resuscitations, and that is Dr. ABCD. D stands for danger, R for response, S for send for help, A for airway, B for breathing, C for compressions, and D for defibrillator. Now, about the compressions. In adults, you need to do 30 compressions and 2 ventilations. But if you don't like to do ventilation, you can use 100 to 120 compressions. And for children, or infants, you need to use 2 fingers to do the compression, but still same rate. Now, do you have any questions? No? If you have any question, I forgot something. Remember, Dr. ABCD, I forgot the D. Is there anyone knows about what is D? For compressions? For resuscitations? Yes, do you remember? That's right. It's a defibrillator. Is there anyone used a defibrillator before? Or have you seen defibrillator before? Okay, that's right. It's a computerized medical device that can check a person's heart rhythm. And it always comes with the ambulance people. So, the person can use only if they train with that machine. Have you got any more questions? No? So, we can proceed now to our return demonstrations to the other room. And thank you. There are some handouts for the resuscitation. You can read for 5 minutes and then we will proceed to the lesson. Okay, the scenario. Someone collapsed in front of you, and then the first thing to do is check for danger, and if it's clear, check for the response by hey, 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 are you okay? No response, it means patient's unconscious, and then send for a help by calling the ambulance, and then check for the airway. Remember in our first lesson? Check the airway, and then the breathing, and then the compression, and then the next is the defibrillator for the D. Okay? So, you can do now the compressions. There you go. Someone collapsed in front of you.
So I have to check for danger. It's okay. And then check for response. Hey, are you okay? Can someone call an ambulance?
Okay, 000. Toot, toot, toot. Oh, yes,
The next is the
Airways. I have to check if if the patient is breathing. Look for any foreign bodies inside the mouth.
That's good point.
It's okay. And then I have to see if he's breathing. He's not breathing, so I have to do the resuscitation. 2, 3, 4, 5, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 2 breath.
Doing well.
5,
That's
6,
good.
7, 8, 9, 10, 12, 13. Can anyone? I'm too tired. Need someone to replace me.
Okay, Linda,
10,
it's your
8,
turn.
29, 30.
Come for a second, Linda. Yep. You need to do like this, like what he did. You use your this area. You put in like this way and do this way and push it like that. 1, 2, 3, 4 with the timing. Okay, try it again. Like that? Yep. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 27, 28, 29, 30. And then blow. Yep, that's right. Well done, Linda. For the babies, you just need to use your fingers, but same compression and to ventilation. Okay? So just same thing in the middle of the chest. Just put 2 compression, 30 compression. Okay. 1, 2, 3, 4, 5, 6. Good job.
9,
That's
10,
right.
11, 12, 13, 16, 17, 18, 19, 20, 26, 27, 28, 29, 30.
Good job. It's your turn, Linda. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13. I think you need to put on the chest. I think it's a tummy. Okay, it's alright, Linda. That's correct. The compression is correct. You just put on the middle of the chest of the baby and not to the. Yep. Okay. Repeat it again.
20.
Repeat it again.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
Well done. That's it.
Where's the breath?
And then the 2 breaths. It's alright. Okay. Now it's time. You need to answer some questions, some paperwork to do it, and we can go back to the table. Okay, there are some questions you need to answer. It's related to CPR, and that's for your assessment. And then there are some papers also there for the evaluations. And I hope you learn how to respond for any emergency cases.